Hello, I'm Dr. Kate Carr. I'm a medical aesthetic doctor, and today I'm going to be talking to you about the fantastic products by Deeves Med. We're going to be focusing on Trehfill and Ami and how these amazing products can be incorporated into your aesthetic clinic. So just a little background about myself. I'm a medical doctor. I graduated from the University of Sheffield in 2003, and I actually first started my aesthetic career back in 2008. I no longer work as a general practitioner. I work full-time in my medical aesthetic clinic, which is based in Cockfosters in North London. And today we're going to be, as I say, focusing on these amazing products from Deeves Med and how they can really help you to have happy long-term clients who keep returning. So Deeves Med is a fantastic company that offers a very large portfolio of products. So it gives you lots of options and flexibilities, and you can really make your treatments bespoke to your clients as an individual. They have pioneering solutions using cutting-edge technologies and really high-tech manufacturing processes, and their products are using high-quality ingredients with very low addition of unnecessary chemicals. So we're going to be focusing on tissue stimulators, and tissue stimulators are really having their moment, rightly so. But it's a term that can be quite confusing for our patients. A lot of patients don't really understand what they are or how they differ from other injectables. So I always think when we are consulting patients, whether this is new or existing clients, it's really, really important to spend time trying to educate them so that they understand, the treatment that you're suggesting and the results that they should expect. And this is how you're going to have happy clients who get amazing results. So when I am consulting new clients, I will set aside up to 50 minutes so that I can spend a really long time with them. It's really important to, not just find out about their medical history, their drug history, allergies. And with allergies, it's not just allergies to medicines. You need to find out about all their allergies. Obviously, find out about their aesthetic history. They may have had other treatments. And it's not, just enough to, find out, okay, they've had this treatment. Find out, what they thought about it. Did they get the results they wanted? Did they not like things about the treatment? And then just try and get an understanding of what they understand in terms of aesthetics. I think, depending on your patient demographic, a large concern amongst patients is that they don't want to look weird, they don't want to look unnatural, they don't want people to know that they've had treatments. And I think when people are first starting on their aesthetic journey, these are all concerns that they have. When we see, celebrities, people in the press that have had fillers where, they've perhaps overdone it, this is the image that comes up into people's heads. So a lot of people want aesthetic treatments, but actually on average, they will, think about it for years and years and years. I think there's a statistic up to 7 years before they pluck up the courage to come to an aesthetic clinic because they are petrified about looking weird or not looking like themselves. So this is where tissue stimulators are amazing. If you can explain to them that these are not fillers, they are treatments that are going to give them beautiful, long-lasting, natural results, slow down the aging process, but they are still 100% going to look like themselves. That is something that clients want. So this is where, tissue stimulators are really coming into their own. Also, I think it is important if clients have only ever had fillers and they're sort of getting to the point where the filler's no longer doing what they wanted to do, or they really don't need any more filler, they're perhaps, going to start looking strange if they have more filler. Educating them around how tissue stimulators can help them and moving them away from the fillers onto these treatments. So there's lots of options. And with the big portfolio, you can do combination treatments. So your treatments can be really bespoke to the individual. And if your clients know that you are putting a lot of thought into their treatment planning, they're going to keep coming back to you and they're going to be very happy. So moving on, tissue stimulators. They have different modes of action. So we lose about 1% of our collagen per year from our early 20s. And for us ladies, when we hit the menopause, this goes up to 3 to 4%. So collagen is what gives our skin that structure, that support, that elasticity. As we lose collagen, our skin starts to sag. We start to notice lines and wrinkles. It's not as smooth, it's not as elastic. So if we can do treatments that are going to boost those levels of collagen, we're going to be slowing down that aging process and we're going to look better. So they stimulate collagen and elastin. They are going to slow down the rate at which collagen is broken down. They're going to help to improve the hydration of the skin, and they're going to help the collagen fibers to reform, and also going to improve the blood supply to the skin. You cannot underestimate, if you had two images of, identical twins, one that has skin that has a nice smooth texture, is well hydrated, doesn't have lots of sun damage and pigmentation, they immediately look much younger than someone who, has dehydrated, uneven, rough skin with evidence of sun damage. So just sorting out the skin will make people look younger. It's not just about filling people's faces. That has its role, but you cannot underestimate the importance of tissue stimulators. So we're going to be, first of all, focusing on Trehfill. This is a very, very unique tissue stimulator, and I'm just going to go through some of the science behind what makes it unique. Again, we're not trying to bombard our clients with science, but just a little bit of understanding so that they understand why you've come to the decision to treat them with a particular product. They're going to be happy that you've thought of them as an individual rather than just a conveyor belt treating everyone the same. So Trehfill, this is a combination of hyaluronic acid, but it also has this very clever sugar molecule called Trehillose. So Trehillose is a sugar molecule, consists of two glucose molecules, and it's actually naturally occurring. So it's in organisms, it's in bacteria, fungi, certain invertebrate, and it's an energy source. But it is more than just an energy source. It's a very, very clever sugar molecule. It helps to protect against environmental stresses. So Trehillose, it has a number of different actions. It protects against cellular stress, and it actually is very well known for anhydrobiosis. So anhydrobiosis is where there is no water or water, that's life trying to survive without water. So this clever sugar molecule is able to help organisms to survive conditions where there is little water. So that's organisms like resurrection plants, yeast, and even some insects. So it also helps to replace water within cells. It forms like a glass-like matrix that helps to preserve the structural integrity of cells. And this helps to, organisms to survive when water is scarce. It also helps to stabilize the membranes of lipids and proteins. And this helps to protect substances from the effects of drying, freezing, or heating. It helps with osmotic regulation. So when we have either shifts with too much water or too little water, our cells are affected by this osmotic shift. So the Trehillose helps to protect cells and stops the cells from rupturing or shrinking when there's these osmotic fluctuations. It also helps to chemically stabilize cells. So unlike a lot of other sugars where they tend to react with things within the cell, Trehillose doesn't. So it helps to chemically stabilize, and this is used in the food industry to prevent degradation, maintain flavor, and maintain the texture of substances. It also can provide thermal stability. So where there's changes in temperature, either extremes of cold or heat, it helps to protect organisms from these fluctuations in temperature. So all these are potential environmental stresses. When you think about hyaluronic acid that we're injecting into someone's skin, It's got effects from the environment, effects from enzymes, effects from the body that are trying to break it down. So if we've got a substance that's sort of protecting and preserving that hyaluronic acid, that means we are going to get long-lasting hydration and results. And it also is being used in medicine. So there is research going on looking at how it can help conditions like Huntington's, Parkinson's, Alzheimer's, these neurodegenerative diseases, because it's stopping the aggregation of substances. And just go back one slide. So just looking at the specific properties, so high stability, as mentioned, it forms this glass-like matrix within the cell. It is able to help organisms to survive when there's little water. It also has a low tendency to absorb water from the environment. It's providing the protection from extremes of temperature, helping with regulating fluctuations in water. It's also has a role in autophagy, so this is helping cells to survive longer and to function better, and also is non-reactive unlike other sugars. So that's our Trehfill with the trehalose and the hyaluronic acid. And then I just want to mention briefly, all these products have something which is fragments of hyaluronic acid. So that's quite unique. There are not many products that are incorporating fragments of hyaluronic acid. Why that is important: when hyaluronic acid has been fragmented, it is able to stimulate the CD44 receptors, which are on fibroblasts, and fibroblasts are responsible for producing collagen. So with the addition of the fragmented hyaluronic acid, we're really stimulating the fibroblasts in a very powerful way, and this is going to lead to maximum collagen stimulation. So as mentioned, the Trehfill is this combination of the hyaluronic acid and the trehalose, and this is going to mean that this sets it apart from a lot of the other tissue stimulators there on the market. It's going to, because of all the effects it has on preserving water, you're going to get an awful lot of hydration from this product, and with that big hydration boost, you're going to get a lifting effect. Trehfill is also a combination of the high molecular weight and the low molecular weight hyaluronic acid, as well as the fragmented hyaluronic acid. So when we look at the composition, we have 50 milligrams of hyaluronic acid in the 3 different forms, and we have 20 milligrams of the trehalose, and it's a 2 ml syringe. So hyaluronic acid, low molecular weight, is helping to fill those spaces in between the cells, and this is providing support for the extracellular matrix. When we look after our extracellular matrix, our cells are going to function better, and we're going to provide optimal conditions for the fibroblasts to grow. And then we have the low molecular weight the high molecular weight hyaluronic acid, which is going to help to reduce that transepidermal water loss. So that's going to help with skin dryness and give an immediate smoothing and tightening effect to the skin. And then we also have the trehalose, which is going to really help to boost the levels of hydration and really going to help to protect that hyaluronic acid from being broken down. So the unique features of Trehfill are in part due to the advanced manufacturing process. They're using something called selective spectrum technology. This is where all the different molecular weights are being organised, and this means that the final product is really maximising the most effective molecules. It also goes through a process called multi-sterilisation. So this is where in the sterilisation process, it's going through a multi-phase stage, and it's almost bringing the product to the peak temperature, but not quite. This means that the end result is still very, very pure, but it hasn't affected the rheology of the product, so the smoothness and how it's going to behave within the tissues. With DeepsMed, they only use the highest quality ingredients. This is really going to impact the results that you get. So pharma grade hyaluronic acid is used in these products. When we talk about pharma grade, we are thinking about the purity of the hyaluronic acid. So they measure the purity by the endotoxin levels, and these need to be as close to zero to be classified as pharma grade. Obviously, the more pure your product with little to zero endotoxins, you're going to have much less chances of having complications or adverse events with the products. And as mentioned, because of the unique formula, you've got the Trehfillose, this incredible sugar molecule, very different to other sugar molecules, and the high concentration of the hyaluronic acid and the 3 different types of hyaluronic acid. It really does make Trehfill a very unique treatment, providing hydration at the greatest level. Finally, just a little bit about the effectiveness and safety. So we've gone through, the manufacturing process, the quality of the ingredients, the unique formula. These are all things that mean this is a very effective and safe product. So just summarising this little slide, we've got the advanced manufacturing process, we've got the selective spectrum technology, we've got the high and low molecular weight hyaluronic acid because they both do slightly different things. We've also got the fragmented hyaluronic acid because that's really stimulating the fibroblasts. And then we've got the pharma grade, really pure hyaluronic acid. And when you put all these together, this really does make Trehfill a very unique product to work with. So there are different techniques, and we will be going through these in the live demonstration. But you can administer this in sort of 5 points on each side of the face and 10 points in the neck. So with this combination, we're going to get a natural lifting effect. We're going to improve the hydration of the skin. We're going to reduce the appearance of lines and wrinkles. We're going to give the skin a nice, healthy glow. And we're just going to slow down that aging process, and your clients are going to look natural. So indications, people that want a subtle lifting effect, people that want their skin to be better moisturized, people that want to slow down the aging process because they understand the benefits of stimulating collagen, in particular collagen type 3, and people who really want to look after their skin and help their skin to age in a healthy, natural way. With a lot of other injectables, the contraindications would be people women who are breastfeeding or pregnant. We will have already taken a really thorough medical history, so we just need to think about underlying medical problems such as autoimmune diseases that are affecting people's skin. If people are having treatment for cancer, certain hematological conditions, obviously if someone's acutely ill at the time or they have an active skin infection, allergies is another important thing to think about. After the procedure, there may be slight redness at the injection points. We tend to say not to exercise or have alcohol or apply makeup for the next 24 hours. Avoid sauna or spa treatments for 2 weeks following the treatment. Avoid tanning, sunbeds, self-tanning creams, and any strong facial procedures for 2 weeks following it. So the recommended protocol, we would normally recommend between 2 to 3 sessions, and this would be done typically 4 weeks apart. And as said, there are different injection techniques. You can really make the treatments bespoke to the individual because DeepsMed has such a big portfolio. You can incorporate different treatments and really get your clients the results that they deserve. So just want to talk about AMY. So there are two products that we're going to be focusing on, the AMY 100 and the AMY 200, and how this can be incorporated with the Trehfill. So the AMY family, so AMY 100, this is designed to be used around the delicate eye area and the temples. So it's very hard treating around the eye area. This is the thinnest skin that we have, throughout our whole body. And a lot of clients are not good candidates for tear trough filler with hyaluronic acid. So to have, a treatment that we can administer safely around the eye area to help to hydrate and thicken the skin and reduce the appearance of lines and wrinkles and improve the appearance of darkness is really fantastic to add to your offering to clients. So it's made from the fragmented hyaluronic acid that we were talking about earlier in the Trehfill. So remember that fragmented hyaluronic acid is going to really stimulate those receptors on the fibroblasts. So you're going to get a lot of collagen stimulation, but it also has a lot of amino acids in there. The leucine, lysine, proline, glycine, about 8 different amino acids in here. So amino acids are our building blocks, the precursors for collagen. So that combination is going to give really powerful remodeling and hydration to the delicate under eye area. And then, so it comes in a 5 ml vial, and you may want to do 1 ml under each eye, and then you may want to do in the temples, 1 ml in the temple areas. You can, depending on your assessment of the client, decide how much they need in each area. And typically we're going to do it in what we call a micro deposit technique. Or you may decide to use a cannula, but normally it would be micro deposits. And typically we would recommend one treatment once a month for 4 sessions. And then AMY 200. So this product is designed to be used on the face. This is similar to the AMY 100, but it has, as well as the amino acids and your fragmented hyaluronic acid, we have in there choline. So choline is a precursor that is needed for the synthesis of acetylcholine. Acetylcholine is a neurotransmitter that has an effect on our muscle tone. So that can help have a strong lifting effect and improve the appearance of wrinkles, just help to give a bit more support to saggy skin. So the AMY 200 also comes in 5 ml, and you do have lots of options. It can be used on the face, neck, décolletage. Really important when we are consulting clients to not forget about the neck, the décolletage, the hands. Lots of clients don't realise that the treatments that they're having on the face can be used for these other areas. It's important to explain this to clients because you don't want their face to be in a different decade to their neck or their décolletage. Also, think about converting those clients. I think we all have those clients who just come religiously for their 3 areas of toxin in the upper third, and they literally do nothing in the middle or bottom third of their face. So these sorts of clients would be great to convert onto treatments, to address the whole face. Different techniques, and we'll be talking through how you can combine these, but you may choose to use a needle, just doing the micro deposits. And again, it would be recommended to do 4 treatments, 1 a month. And then we'll be moving on to the practical. Thank you for listening. Welcome back. So for our beautiful model today, we are going to be doing a very bespoke treatment for this beautiful model. We are going to be doing a combination of the Trehfill with the AMY 200 but we've made the decision that we are going to mix these two wonderful products together, and we're going to be doing this with a cannula because this beautiful client has got social events on this weekend and doesn't want any bruising or downtime. So we've cleansed the skin and we're just going to start by sterilizing. So we're using Clinisept to sterilize the skin, and we always want to make sure when we're doing any sort of injectable treatment that we thoroughly disinfect the skin, so there's absolutely no chance of any bacteria getting in anywhere. Okay. Next, we're going to move on to mixing our products. So we've got our amazing Trehfill. This is our hyaluronic acid. Remember, it's got the 3 different types of hyaluronic acid. We've got the low molecular weight, the high molecular weight, and then we've got the fragmented hyaluronic acid. And with this, we've got the Trehfill, that amazing sugar molecule, which is going to really help that hyaluronic acid to stay in the skin for a long period of time. It's going to hydrate, it's going to protect the skin from oxidative stress and environmental stresses, changing temperatures, whole host of things. So this is a really amazing, powerful biostimulator. And it's really important to educate our clients about why we've gone for a particular treatment or a particular combination treatment. Educating our clients is what's going to keep them coming back, and they're going to understand, the decisions with their treatment plans. So we have now got our Trehfill 2 mils, and we've got a 5 ml syringe, and we're going to decant with our little connector the 2 mils into this 5 ml syringe. You just want to make sure that all the connections are secure. We don't want to waste any of this precious product. So now we have got the Trehfill 2 mils in this 5 ml syringe. Okay, I'm going to put that to one side, and next we're going to draw up the Amy 200. We're going to be using 3 mils. So we'll remove the protective metal cap. Always important to make sure everything is sterile. With our alcohol wipe, we're just going to clean the bung, and then we're going to withdraw with another 5 ml syringe. We're going to take 3 mils of the product. I find it easier to draw up with a large gauge needle. So the Amy 200, this is an amazing cocktail. We've got the fragmented hyaluronic acid, we've got the amino acids, the building blocks for our collagen, and we also have choline in here. So choline helps to synthesize acetylcholine, the neurotransmitter. So this is great for helping to tighten up the skin. So we now have our 5 ml syringe, and we're going to mix. Really important when you are mixing products and you're decanting, always make sure that both syringes are big enough. It's very easy to put too small a syringe on and you're going to be adding a bigger volume. I've seen many times products go flying all over the room. So we're going to mix the products. Just go slowly to begin with, and then when you're confident that everything's as attached as it should be, we're just going to mix. And you want to make sure that it's nice and uniform. So I would recommend doing this at least 30 times. Fantastic. Okay, so we now have a total of 5 mils, so we're going to be using 2.5 mils per side. I'm going to now decant this back into the 1 ml syringe. And you just want to do this slowly because you don't want to risk the product going everywhere. So we're just taking 1 ml, and then we're going to attach our cannula. So I'm going to be using, I've got a 25 gauge 50mm cannula. And I'm just going to mark up. So we're going to do a little bit, deposit a little bit of product up here into the temple region. Temples often get neglected. It's an area where we lose volume and it needs attention. We want to thicken up the skin there, and it also just helps to give some support to the lateral brow. And then we're going to sort of be working laterally, little injection point here, and then another one here. So we're only really going to be making 3 little entry holes. I'm just going to mark up on this side. Fantastic. So then we're just going to take our little introducer needle. We've already sterilised the skin, but I do like to just wipe the entry point again before puncturing the skin. So I'm going to start on this side for Agnes, and we're just going to make a tiny little entry hole. Little sharp scratch, well done. So I find when you're using cannulas, you really want to sort of make sure that you've got a good entry hole, otherwise it can make it quite tricky to get the cannula in. Again, when you're putting your needle down, I always find it good practice to put it back in the protective cap. This needs to be kept sterile, so it mustn't touch anything. Here we have our cannula. Little bit of pressure here just as it goes in. Fantastic. Little bit of pressure. So we're just gently gliding the cannula up into the temple region. And we're just going to be depositing fine linear threads. Little bit of discomfort, well done. I'm just depositing approximately 0.4 up into the temple. It's very easy to inject, and then we're just going to work in the lateral part of the face. Again, with your cannula, make sure your cannula is remaining sterile, it's not touching anything. Put the protective cap back on. Re-clean, and we're just going to make a little entry hole, little sharp scratch, well done. A little bit of pressure just as the cannula goes in, making sure it doesn't touch. A little bit of manoeuvring can sometimes be a little bit tricky to get the cannula in. That's it. Fantastic. Okay. And you could do this with a shorter cannula, but I've opted for the 50mm just so we can cover a large area, and we're just going to be doing linear retrograde threads, so just injecting as I'm withdrawing the cannula, just A little bit of the Nouveau. Doing ever so well. So we've used our first mill. Remember, we're doing 2.5 mils per side. So we're going to do to get our second mill ready. So going back with our 1 mil and just gently and slowly just get our product back into the syringe. And we will be covering the majority of the face, but we are really concentrating this lateral part of the face, sort of where we've got a lot of the connective tissue. We want sort of that lifting effect. So going back into our same entry hole. And I just wanted to pause it a little bit down here towards the angle of the jaw. A little bit of pressure, well done. So just coming down to the angle of the jaw. Fantastic. And I'm just going to draw up the last 0.5 of my remaining product, and we're just going to treat a little bit more immediately. So that's leaving 2.5 mils for the other side of the face. So cleaning our entry side, little sharp scratch. 1, 2, 3, well done. A little bit of pinching, well done. Just slowly advance our cannula. To check your depth of your cannula, you shouldn't be able to see the colour of the cannula, but you can see as I'm lifting, I can see sort of the outline, so I know I'm mid-dermis, I'm at the right depth. Because we've gone for the nice long cannula, I can cover a big area from here. So we're just going to come a little bit psoriasis into the marionettes. And then we're just going to come round towards the nose to mouth lines. Right. Just depositing nice long linear threads. Fantastic. So that is half the face treated. Sometimes it is possible after just treating one side of the face, if you sit the client up, that you can actually immediately see a slight lift. I can never guarantee it, but it is an option I often give my clients if they'd like to sit up and have a look at the treated versus the non-treated side. Sometimes you can already see an immediate lifting effect, but obviously this treatment is a biostimulator. It's going to work with our client's body. It's going to take time for all those biological processes to happen. But the beautiful thing with this treatment, we've treated the temples, the mid face, the lower face, all from 3 little tiny injection points, and she will be able to go about her day with no bruising and no signs that she's had a treatment.
Awesome.
So we're going to move on to the next side. So going back to our 1 ml, so we now have the 2.5 mils of the product remaining. Nice and slowly. Fantastic. So we've got our 1 ml. Just turn your head slightly that way. Again, just re-sterilising the entry points. Just going to go in with our little introducer, little tiny sharp scratch. Fantastic. And you just want to, when you're doing these treatments, just keep, note of the volumes that you're using per area, because you want to, put equal amounts on each side. So we're just going to go into the temple and we're going to deposit 0.4 in this area. A little bit of pressure, well done. Fantastic. Perfect. And then we're just going to move on to the lateral. So I've already re-cleaned my entry site. Tiny little sharp scratch. Little bit of pressure. Fantastic. Sorry, lovely. Okay, so we're just going to again do the retrograde linear threads. So we just want a little bit more product for here, so that we're going to have 1 ml left for the final point.
Bios.
We're leaving 1 ml for the final area. little bit of pressure just as it goes in, so we're going down towards the jawline. Get a nice subtle lifting effect around the jawline. Sorry. So this is our last point here. Tiny little sharp scratch, well done. And I do find just moving the introducer needle around so that when you come to change direction with your cannula, you've not met any resistance. So it's very normal for the introducer sites to bleed. Just try and keep an eye on it, particularly if you're working on your own. It's very easy to be distracted with your table and needles, and you turn back to the client and they've got blood running down their face. So just try and make sure you're pressing on any little bleeding points. Okay, so we're just going to go in for our final. Just a little bit of pressure here, just as the cannula's coming in. Just going to come down towards the marionette. It can be a little bit uncomfortable down here, but it's over very quickly. Just little linear threads. Just helping to support the corners of the mouth. So we're just going to change direction. Coming up towards the nose to mouth lines, again can be a little bit sensitive in this area. Sorry, lovely. Fantastic. So that is all the treatment done. Really important to clean your client's face properly. I always think it's good practice to disinfect the skin again. You cannot disinfect the skin enough, but literally we've done the whole treatment just from three tiny little entry holes. So I'm just going to give it another clean just to make sure that you don't want your client leaving with dried blood on their faces. We're going to give it another clean, and then we're going to actually apply a nice calming sheet mask. But the lovely thing is this client doesn't really have any telltale signs that they've just had a treatment. So by doing the treatment with a cannula, this is something that someone could have done in their lunch hour and go back to work, and no one would be any the wiser. Fantastic. So we've re-sterilised, and then we're just going to apply the redless mask. how nice and cool. Okay, so we've got a lovely calming anti-redness sheet mask here. So we're just going to pop it into position, and then we're just going to peel off this part here. This is a really nice step to do at the end of the treatment. Obviously you could give the client the mask to take home with them, or they could, you know, buy the mask from you. But you know, for this particular client, we've gone to the effort of using a cannula because she didn't want any downtime, any telltale signs. She's got a busy day ahead of her. So adding the sheet mask just to calm down the skin and any redness is a really nice end step to the treatment. And it's little touches like this that are really going to set you apart from other clinics. Thank you so much for watching the webinar. Really hope that you've learnt something and that you managed to incorporate these fantastic products into your clinic offering. The Deves Med really do have an amazing portfolio of products which offer lots of flexibility for your clients and really fantastic long-term anti-aging solutions.